What's up, y'all? It's Key, and we finna go over a case study together, and I'm gonna show you how I answered it and got it right. Um, I'm gonna do more if y'all want me to do more, and if y'all in school, y'all finna take y'all NCLEX, I'm gonna show y'all how I got a little bit better at taking them. So let's get into it. All right, so I have the case study pulled up. I'm gonna get my face out the way a little bit lower so that way y'all can read it, but I'm gonna read it from the computer. So it says, client was seen in ED 2 days ago after a fall. Oh, wait, let me go back to the beginning. So it says the nurse is caring for a 78-year-old male from a long-term care facility who was transferred to the emergency department with pain under the left lower calf and burning in the left foot. Three things that I see already in this first little sentence is one, 78-year-old male, they have some type of fracture due to a cast. So I'm thinking compartment syndrome or DVT already. That's the two main disorders that's coming from that. When it comes to stuff like this, and you looking at what the question, I ain't even read the note yet. I already did it, but I'm just telling you, I already did it. But in my head, I'm already playing like an S bar scenario in my head, saying like, okay, they have a left lower cast. They said they have pain and it's burning. So anything that's pain and burn, I'm thinking in my head they either having some type of compartment syndrome will be number one, and then DVT. So let's get into this case. It says client was seen in the ED 2 days ago after a fall in a long-term care facility, fracturing left tibia. See, bone was set and cast, and client was discharged back to the LTC, long-term care facility, 2 hours ago. Client report pain under cast and burning in the left foot to the LTC nurse. That's on new onset. That's a new onset, meaning like that's new. It's not like it's been there. It's like new onset. So yeah. Who knows left foot was significantly cooler and paler than the right foot. So we know that the temperature of both foots is not even. LTC nurse notified provider who ordered client to be transferred to ED. Client reported pain under the cast and in the foot and rated 7 out of 10. No other pain noted. Client also has burning and tingling in the left foot. Able to move toes on left foot but unable to feel light touch. Client able to feel light touch and report pain. Client able to feel light touch and reports no pain, burning, or tingling in right foot. Dorsalis pedis pulse in both feet palpable, with left weaker than right. So some type of blockage. Lungs clear bilaterally, no shortness of breath. S1, S2 clear on heart. Rhythm regular. Skin pink, warm and pink, except for left foot. Normal bowel sounds heard in all four quadrants. Vital signs 97.2, good. Heart rate 74, good. Respiratory rate 18, good. Blood pressure a little bit. Well, they claim that's normal, but that's a little bit elevated. And O2 saturation. Before we even move on to the bow ties, like I was saying, this literally plays a picture of either compartment syndrome or DVT. In this type of situation, you really want to kind of know, like, this is the process of elimination. That's why I always tell people that's taking patho to always take patho serious, because you won't know those signs and symptoms of certain things if you don't take patho seriously. If you just like getting through nursing school, like how y'all getting through nursing school, that's how y'all never gonna like. That's not how you literally not gonna able to like answer questions like this, especially when it's not like a multiple choice A, B, C, or D. No, this is like a bow tie. Like you literally got to create a care plan, and we're gonna go on to the next page on why. But I just want to explain that before we even move on. It's a bunch of clues. Pain was 7 out of 10. Client reports pain underfoot, pain and burning. That's already instance of a blockage going on. They said that they had a strong pulse in the right foot, but a weak pulse in the left foot. You already know it's either some type of obstruction or something is like compressing on that nerve or compressing on that artery, not nerve, I'm sorry, that artery causing blockage. So that's why they feel that pain and that burning. And it's a new onset because they just came back to the hospital 2 hours ago and they're having that. So the cast might be on too tight. It could be that. And then mostly, I know y'all like to say like, oh, but mostly you see compartment syndrome in car accidents. That's true. But Mainly, you see compartment syndrome and crushing pain. A cast can cause crushing pain. So let's get it. Now, do y'all see all the answer choices? I'm gonna be looking over here at my computer, but I'm just showing like all the answers. I hope y'all can see it because I just took a picture from my computer. All right, I took a way better picture. Okay, so these are what's called Bowtie questions. At first, 2 quarters ago, these was giving me trouble because this is like a patho type of thing. Like they'll give you like our exams now. They give you like different scenarios and an exam, like a whole case study, like I just showed you, and you as a nursing student have to figure out what is going on with the patient. They're not going to just give you the disease and disorder. You have to say what the disease and disorder is. What are you going to monitor and how you going to implement it? Right, but I got it right. So let me say, okay, back to the scenario. Remember we were saying that we could eliminate a lot of these. So let's eliminate. We want to start with potential conditions. So we want to know what the condition is. We can't intervene and monitor anything if we don't know what that condition is. So we're gonna start with the condition. So again, we literally had two: fat embolism syndrome and compartment syndrome. But we can eliminate renal calculi because they're not having no kidney issues. None of that is screaming kidney issues whatsoever. Osteomyelitis, we can eliminate osteomyelitis because it's not saying nothing about no porous brittle bones. Maybe the fracture, because that is an older male, that he can prone to fractures. But, even males can get osteoporosis, but it's mostly in women. And two, that's not what they're talking about. They're not talking about the fracture. They're talking about the complication of that cast. So either fat embolism or compartment syndrome. Well, we can get rid of fat embolism syndrome because they're not having no atherosclerosis. They didn't say nothing about them having any type of plaque buildup on their arteries or anything that's breaking off and going into different places. No. So we choosing compartment syndrome. Now, I would say next we're gonna do action to take. I used to do parameters to monitor, but I feel like that's like a evaluation, like the end of the ADPI. I feel like AD, this is the diagnosis, this is the implementation, and this is the evaluation. I feel like we, like ABCs, like airway, breathing, circulation, go in order. Now, out of all of these, you got to understand what compartment syndrome is. Like I said, compartment syndrome is a disorder where it's like a crushing disorder. Like let's say you get into a car accident, like your nerves and all the arteries and stuff starts to crush in that leg, and it's predominantly in the leg. So once you have that crushing sensation in the legs, the muscles, it's causing like ischemia going to the peripheral arteries. So that's why they have extreme pain, pallor, all that in their leg, and different disorders, cool to the touch. That's why I chose compartment syndrome. I would have been chose it, but I gotta put all my patho together. So of course, one, draw troponin level draw blood for troponin levels. They're not having a heart attack. Not having no heart damage, so that's out. Anticipate an order for antibiotics. They have. Excuse me, I stuttered a little bit. They don't have no active infection going on. They're having burning and they're having a 7 out of 10 pain. Anticipate an order for anticoagulant. I would have chose that if one of the options was some type of DVT, but they're not having DVT. They're having compartment syndrome, so that's out. So the only two you would do is assisting with I don't know how to say that, but violating the calves, meaning like open it to kind of like let the leg breathe and evaluate, elevate the client's leg. So just lift it up, and then parameters to monitor is you're gonna get rid of fever because they're not having fever. Everything cool to the touch. Urinary output, there's nothing going on with their renal system, and oxygen saturation. Then it said lungs were clear, bilateral and clear. So we're basically monitoring the level of pain because that's the chief complaint, and parasynesthesia because that's the other chief complaint of what is going on in that patient. Otherwise, y'all, I hope that helped. If y'all want more help with dosage count or anything that I can, that I'm able to do, I'm your guy. So let's get into it.